The recent spike in COVID-19 cases fueled by the Omicron variant seems to be in the rear view now. So how do all of those cases we saw over the past few weeks actually help move us forward? Joining us now to talk about all of it is Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna vaccine trial. We appreciate you being with us once again, Dr. Hartman. We know it's now estimated that about 73% of the U.S. is immune to Omicron. Is that enough for herd immunity? Is herd immunity even a thing anymore?
Well, I think that that's a really good question. And it's hard to answer, but if we think of it as, say, 5 people sitting around a table, that virus is only really wanting to infect that one person that isn't immune. So the other 4 people, because of the immunity that they have, are protecting that one person through a couple of ways. Number one, if they are infected themselves, they're able to drive down that viral load and are less likely to pass that virus on. And number two, because they are immune, when the virus gets into them, it's less likely to mutate and cause itself to become a form that will infect that one person at the table. So the idea of protecting our most vulnerable, who are people without immunity at this point, is really something that I think can be highlighted by just thinking of it in that way. And so the fact that we're at this level of community immunity is a really good thing. And moving forward, we're going to be able to protect our vulnerable people.
Now, taking that information and basically just kind of putting it into everyday use, people want to know, is it time for masks to come off? Can that be something that we can put behind us at this point? Is it time to normalize?
Well, I think that we still have to be cognizant of the fact that this is a global pandemic, that this is a virus that with the last couple of variants coming likely from India and from Africa, where vaccination rates are very low, and that virus still has a chance to mutate and take on forms that can infect people. That being said, in our own communities, we have a very high level of immunity. And so the discussion is a good one, and one that we should all be having about a person's own personal feelings about taking that mask off, especially indoors when they're going to church, going to school, etc. I think that this is a very good conversation to have, and this is the time to have it. I think we're in a place right now that is really as good as we've been since March of 2020. And going forward, things are only going to get safer.
And you mentioned that, in terms of vaccinations, a lot of people have had 3 COVID shots at this point. Some are starting now with that 4th. Talk to me a little bit about boosters quickly and what you predict will be our future when it comes to staying vaccinated against this virus.
Well, there's a very important clinical trial going on right now where we're looking at, not us here at University of Wisconsin, but other researchers are looking at to see whether or not a specific booster for Omicron will give a level of immunity more than just another shot of the Pfizer or Moderna vaccine that people have already had. And I think it's important to keep an eye on this one because the future mutants are going, or the future variants are going to be mutations of that Omicron variant. And so can we predict what the virus is going to look like? And in doing so, can we have a booster that's made to attack those variants? So it can just be a once-a-year shot, similar to what we see with the flu vaccine.
Yeah, it'll be interesting to see where all of this ends up. Dr. Bill Hartman, thanks for being with us. We appreciate it.
Thank you.